Hi, and welcome to Treatment Update from CROI in Seattle. My name is Jeff Berry, and I'm here with some members of the Fair Pricing Coalition, which myself, I'm a member. I'm also editor of Positively Aware magazine.
Hi, my name is David Evans, and I'm the Director of Treatment Advocacy for Project Inform.
And I'm Murray Penner. I am with the National Alliance of State and Territorial AIDS Directors, or NASTAD, and also a member of the Fair Pricing Coalition.
Well, welcome. So the Fair Pricing Coalition is a group of advocates that work with pharmaceutical companies on pricing and access issues for HIV and Hepatitis C drugs. And we're here today to talk about some of the recent developments in access and pricing on HIV and Hep C antivirals. Most importantly is some of the recent changes and expansion in some of the pharmaceutical programs that are helping people to pay for their medications either through patient assistance programs or copay programs.
Do you want to take?
One of the big things I think we've been faced with this year, obviously, is implementation of the Affordable Care Act and what that means in terms of people's primarily out-of-pocket expenditures if they actually have insurance. And so one of the things that we focused on a lot this year as a coalition is increasing access to the resources that are necessary to maintain provision of therapies through the copay programs in particular. So we have worked a lot with the pharmaceutical companies to increase their amount of assistance that they will provide to individuals to make sure that their out-of-pocket expenditures are not a barrier to them continuing to be able to get their medications. And we've been successful in getting most every company to a much higher level of coverage for the secondary insurance, if you will, or the secondary payment of their co-payments. What we've seen with the Affordable Care Act is a lot more co-insurance, a lot higher co-insurance, drugs that are on a specialty tier or a Tier 4 or Tier 5 within plans, and that means that co-payments and co-insurance is really high. So we don't want that to be a barrier, and we've convinced a lot of companies to increase their amount of coverage. Some of them up to the out-of-pocket expenditure limits within the Affordable Care Act, some of them higher, so a few of them a little bit lower, but generally between $5,000 to $7,000 in coverage for a year, which covers almost all of the out-of-pocket expenditures that you might have if you have insurance through either an exchange, one of the state or federally based marketplaces, or through your even individual employer insurance coverage or private plans.
And Murray, a lot of these changes have come about is because we were seeing a lot of patients that were increasingly, the costs were being moved over to the patient, and they were being more held responsible for like deductibles and co-insurance, as you said, and higher co-pays. And so the Fair Pricing Coalition, we've been really working to advocate and successfully with many companies to increase the amount that they cover.
Yeah, and I think we've been successful in getting that. One of the other challenges is that not everybody knows about these programs, and so you might have your own coverage, your own insurance plan, and you go to the pharmacy and all of a sudden your cost that you are required to pay has gone up from maybe $50 to $500, and that's the kind of time when these programs step in and are really useful, but we find that a lot of people don't know about those. So if you happen to be in that situation, we would strongly suggest that you go to the Fair Pricing Coalition's website and take a look at the programs that are available, because in many cases the manufacturers have programs that will cover those costs that you might encounter when you go to the pharmacy.
And there's also there are also medications that you can take to prevent HIV, and so I know, David, you've been collating a lot of that information. Do you want to talk a little bit about what those programs are looking like and what areas are for improvement?
Sure. So in 2012, the FDA approved Truvada for the use as prevention of HIV. And when that happened, Gilead, the maker of Truvada, put together an access program that offered assistance to people making up to 200% of the federal poverty level, and provided $200 a month in co-payment assistance. And once more and more people began to use Truvada for PrEP, and particularly as the Affordable Care Act began to be rolled out, we found more and more people who those access programs were not generous enough to help them take PrEP. As Murray said, people would go to the pharmacy and find out that their out-of-pocket cost was like $1,100 for the first 6 months until they met their deductible. And this is just not acceptable. So in partnership with other groups, the Fair Pricing Coalition has advocated for more generous programs. And Gilead has made some movement in that direction, but further advocacy is ongoing to make sure that we can help the people who need PrEP the most.
And then what about post-exposure prophylaxis? So if you don't take the drug to prevent HIV, there's drugs you can take after exposure within 72 hours. And are there programs in place for that, or is there room for improvement?
There are. So all of the, not all of the HIV drugs that are used for treatment are also used for post-exposure prophylaxis. And there are a number of reasons for that. One of them being that you don't always know whether there was drug resistance in the person who passed on HIV to the person, or you don't always know whether there was drug resistance in the person that the HIV negative person was exposed to. And so, but for those drugs that are commonly used, they are typically under the same heading as the patient assistance programs for treatment. So they're pretty generous in terms of the amount of access and assistance that they offer.
Murray, you had talked about some of the changes in terms of specialty tiers for drugs. Did you want to talk a little bit more about that? Because I think some people aren't aware that they're kind of the companies, the payers, the reimbursers are kind of moving people to take different regimens that are more cost effective but may not be good for the patient.
Sure. So one of the ways that insurance companies in particular manage their costs and keep their costs low is they might put higher cost medications on a higher tier within their drugs formula or plan's formulary. So it's not really often very widely publicized what a formulary looks like, but if you look into your company's or your insurance coverage's plan, you will see that there are tier 1, tier 2, tier 3, maybe tier 4, sometimes even tier 5. It depends on the formulary, and then specialty tiers. And what we are finding is that a lot of HIV medications get placed on those higher tiers, and in particular some of the combination therapies. So if you're on some of the atriplas or the stribilds or some of those others, you might find that those are tiered even higher than others. And what we're finding is that is becoming far more common for some of the antiretrovirals in both HIV and hepatitis C in particular, as well as probably some other disease areas as well. But it's certainly something that makes these programs that we're talking about even more important.
And there was a recent ruling that talked about those exclusions, and from HHS or CMS, I believe.
There's been refinement of those rules to try to reduce the discrimination that some people are saying this is towards people living with HIV and hepatitis C and other conditions as well. So there is movement, I think, in trying to reduce that tiering of drugs at the very highest levels, but we haven't seen that all actualized yet.
And definitely more work to be done.
Absolutely.
So thank you to David Evans and Murray Penner. This has been a great discussion. There's a lot more information available at fairpricingcoalition.org, and also nastad.org and projectinform.org and positivelyware.com. We have lists of the different copay programs and details associated with those. And NASTAD has information about ADAPs, state ADAPs, which are really important for people who are using those services in their respective states. So thank you, and goodbye.